Do you know what Gwaan, where you can get news about the Jamaican culture and just learn about how Jamaicans are doing, as I said, yard and abroad.
You get to learn a new Jamaican patois word or even a Jamaican phrase.
I look forward to the patois word of the day.
The patois word is pasa pasa.
Word today is taco ram.
Our word of the day is duffy.
Twang. No little twang. Not true.
I enjoy tuning in to What a Gwaan.
It happens every Friday at 7 p.m. So check them out. And bye from Toronto.
Dads, Québec et la Jamaïque. Écoute What a Gwaan. Yes, What a Gwaan.
I am a big fan of What a Gwaan.
Relevant and entertaining, so keep up the good work.
Watch What a Gwaan.
Big up yourself. What a Gwaan.
What a Gwaan. Yes, What a Gwaan.
Watch What a Gwaan.
Always say I'm going to walk Gwaan in a yard. Check it out. 7 p.m. every Friday.
Let's do this. Greetings. Today you get me. Welcome again to another episode in What a Gwaan National, where we share information, where we connect. Nicole has taken some time to go off into the bushes. She has gone camping, at least, so she said. I hope she's having a good time. I'm assuming that she's not watching. So today is just me. But we have a great story. Before we get into all of that, we want to welcome those who are listening on Fresh FM London. Always a pleasure sharing the content with you. And for those who don't know, What a Gwaan is available as a podcast on Podbean and all the major podcasting platforms, Amazon, iHeart. Just check them out. In fact, just go to our website, www.whatagwaan. And as Nicole always says, Gwaan has 2 A's. whatagwaan.ca, where you can watch the episodes and listen to the podcast. It's June, believe it or not, it's June. We have started the 6th month of the year. Hopefully it's nice where you are. It's fantastic here in Calgary. Temperatures in the mid to high 20s. For us, that's summertime weather where we're enjoying the weather. For June, we're going to be focusing on our men. Father's Day is a few weeks away, and we want to spend some time talking about our men. Today, we're going to be looking at cancers and how they affect our men and their families. And we've got some great guests in the wing who we're going to bring on in a little bit to share some information about that. But of course, a staple of What a Gwaan is this feature. It's called Patois Time. And the Patois word for today is galang. So if you are Jamaican or if you understand Jamaican Patois, what does galang mean? Put it in the comments. I'm hoping we can get some people jumping on and sharing their experience of Jamaican Patois, or of course some real Yardie who understand what it means, right? Later on I'll come back and give you my take on galang and how I'd use it in a sentence. But for those who are watching, the Patois word for today is galang. And as always, we're looking for feedback and comments, and we love when you engage. We love when this is interactive and people are listening and learning and enjoying what is happening. So let's see what happens here. Patois word for today is galang. Let's do a little recap. Last week we, like I said, focused on our men, and we were talking about male mental health. And we had Timmy Abiola, who is a registered nurse and mental health practitioner, share some valuable tips with us about how to deal with the issue of mental health. And he encouraged our men to do a couple of things, to adopt self-care, make it a part of your routine, to find ways of building purpose into your life. And he, as a person of faith, said, people should connect with faith. He's not saying everybody should become Christians, but he's like, find a faith base and use it. He also talked about the need for us to debunk some of the ideas that our culture has taught us, and that if we don't move away from some of those, then it makes it a little bit harder and we stay stuck. As always, like I said, if you missed last week's episode, jump on any of our social media platforms. You can connect with us there. You can get access to the previous episodes. As always, we ask you to follow, share, like, subscribe, and comment so we can grow Gwaan, but more importantly, that you can stay connected to what we're sharing on the program. Some news, what's happening in different places. On Montreal, if you're in Montreal tomorrow, the Jamaican Association of Montreal is hosting Tribute to Reggae Greats at the Jamaican Association Center at 4065 Jean Talon West. Doors open at 8 p.m. Showtime is at 9 p.m. Go enjoy performances from Jakota, Melody, Juliet Nelson, Singer Curve, Robin, Ebony Royal, and Paris Ivy as they showcase songs from many of the greats in Jamaican music. Admission is $20 if you buy your ticket on Eventbrite. If you show up at the door, it's $25. Also in Montreal, the Collective Kitchen Project and the Jamaican Association of Montreal presents a free family cooking classes. Join them every other Monday at the JCA Center on between 5:30 and 7:30 p.m. to learn and to create new recipes. To register or for more information, just send an email to jamfootstepsprogram@gmail.com, or you can call 514-737-8229. The next session is June 12th. If you are in Calgary, there are plans already afoot for CarryFest 2023. Many activities are being planned, and you can join the revelers at the Container on July 5th for the band launch. The event is going to start at 5 p.m. The Container is at 1020 2nd Avenue Northwest. So start planning to join the action. And if you want more information, you can go to www.carryfestcalgary.com. And of course, there's always a little bit of news from Yad. So here is some stuff that's happening down in Jamaica. The economy grew by 2.7% between January and March of 2023. The Planning Institute of Jamaica, in its latest preliminary estimate, has reported that real value added for gross domestic product of approximately 2.7% for the first quarter of 2023. The outturn for January to March 2023 largely reflected the impact of increased external demand, especially for Jamaica's tourism product, coupled with the positive performance in the transport, hotels, and restaurants and other services industry. The growth of almost 96% in the mining and quarrying sector, with the reopening of Jamalco bauxite plant, contributed significantly to the growth.
The Center for Intellectual Excellence presents the World Diversity in Leadership Conference 2023 from June 20th to 23rd at the Nisku Conference Center near Edmonton, Alberta. Hear speakers including Margaret Trudeau, Minjit Minhas, Dr. Denise Green, and many great panelists focus on the themes of climate change and mental health. To register and get more information, go to www.wodil.ca or call 780-229-0759.
right. So there you go. The preliminaries, the news, things happening down at Yard. And I want to tell you that the economy was growing on tourism. Every big plane is flying from Canada to Jamaica. So there's no question that it's affecting GDP. But it's time for another segment of a Gwaan. And this is where Nicole would say, with the big man or whatever it is. It's a time to reason. This has been a great discussion. David, thanks for taking the time. All right. All right. No banter and asking any questions today. We're just going to jump right into it. Today, we're going to talk about cancers and educating our men and their families about this particular issue. Joining me in a little bit is Kenneth Noel. He's the president of the Walnut Foundation, and this is a men's health interest group, and they focus primarily on prostate cancer and bringing awareness about the increased risk of prostate cancer. Ken himself is a cancer survivor, and he has dedicated his time to educating men and the community about this particular issue. Also joining us will be Yinka Oladele out of Calgary, who is the founder of the Oladele Foundation, which is a community support group for Black cancer survivors and their families. And there are a number of things that she's doing through that foundation within the community to help us understand the impact of cancers on men and our families. And it's an absolute pleasure to have Yinka and Ken join me today to discuss this very important topic. Yinka, Ken, welcome to A Time to Reason here on Gwaan.
Thank you. It's glad to be here.
Thank
All
you.
right. Before we get into the serious stuff, Ken Galang.
So, my name is Ken Noel. I'm the president of the Walnut Foundation and a prostate cancer survivor. So, about more than 10 years ago, I was diagnosed with prostate cancer, couldn't figure out why. So I went searching for answers. Why me? The question was, why me?
Mm-hmm.
Couldn't find much information, but all I knew is that I was starting to attend funerals of Black men dying of this disease. So I said there got to be answers. I set out my life to start to understand the risk to Black men and to educate Black men around this.
Yeah. All right. We soon come to you on the prevalence of it. Yinka, you walked through it both as a member of the family and also as you've launched this foundation. How do you relate to the prevalence of cancer in Black men and in the community?
Thank you. Like you said, I have my husband was actually diagnosed with multiple myeloma. It's a cancer of the plasma cells. At that time, I didn't know what it was. I didn't even know what myeloma was. Like, you hear of other cancer like prostate, liver, all those kinds, but I didn't know what myeloma was. So I researched it, and even studies shows that Black men go through myeloma. However, the studies are in the US, not in Canada, because we don't do race-based data. We don't collect race-based data in Canada. So when I researched, and I'm like, oh, if it's prevalent among Black men, how come we didn't know anything? So someone had to, it's like importing someone from the US to come and talk to us about multiple myeloma.
Right.
And the reason being that when people are diagnosed, people don't talk. You hear that people die either when they are dead or when it is already late. So we went through it, the journey. It was not an easy journey. And when my husband got better, we wrote a book, Second Chance: Surviving the Battles of Cancer. And there, people now started to reach out to us that, oh, they didn't know they can talk about cancer. that, oh, this person has cancer, this person has cancer. And we will visit people. That was when I knew that, yes, a lot of people are actually going through this thing. Even up till now, we still have people that don't want to come out, which is okay, right? It is like a taboo, it's a stigma in our community, and we are trying to destigmatize cancer. So in our community, in the Black community, a lot of people are going through it. We are trying to break the wall of silence, the wall of secrecy that surrounds cancer. Is going on. Like we said, we have the foundation. We started the foundation. It's just to be able to help people.
Right.
We bridge the gap between the hospital, the community, and the patients.
Let me bring in, let's talk a little bit about the prevalence of cancers, and especially prostate cancer.
Yes.
Share some data with us.
Yes, good question. So if we look at the World Health Organization, we found that more men die of prostate cancer than any other ethnic group. And in 2020, the top 10 countries with the highest death rate were either from West Africa or the Caribbean. Barbados was number 2 in the world. Jamaica was number 5, and Trinidad and Tobago was number 7. So if you look at that, and then we look at Canada. So we don't keep race-based data, but we took part in a research that looked at prostate cancer among immigrant men coming into Canada. And the data reflected what the World Health Organization said. Because where do we get our immigration from? The Caribbean,
Right.
West Africa. So we're seeing the same thing within Canada as well, even though we don't keep race-based data. So the men who come to us for support are men of Caribbean descent, men of West African descent. So it's very prevalent in the West African and Caribbean descent communities. So the Canadian Cancer Society says that 1 in 8 men will be diagnosed with prostate cancer in their lifetime. But for the Black community, which is West African descent, Caribbean descent, it's 1 in 4 men will be diagnosed. So if you look at the statistics in the United States and the UK, which have high Black population, so you find the same data that, Black Americans, Black people living in the UK have the highest incidence of prostate cancer.
Well, somebody listening to that could easily get scared, and they're like, oh my God. And Yinka, you were saying people don't necessarily want to talk about it. So how do we help the families deal with the occurrence? Because it's not an if in many cases, it's a matter of when.
Exactly. So, we meet a lot of people. I was speaking to a young lady 2 weeks ago parents are from West Africa. And so they know that father had prostate cancer, but he refused to tell them the extent of it. So they think he was okay because he said everything was fine. So he went back to Nigeria for the summer vacation, and passed away in Nigeria. So they wanted to know. So they said, well, something is wrong with the hospital system in Canada. But when they checked with the doctors here, they found that he was going for treatments every 3 months and never told his family anything. So they left holding this whole thing about why my father. But he chose not to share that with them.
Yeah.
And that's devastating to the family.
Talk to us about the family connections and you having to deal with it firsthand. How do you relate to what Ken's saying, and what do you say to the community and the wives and children?
I don't know if I've told you before. I actually lost my mom to breast cancer. That was in 1995. Then 2016, my husband was diagnosed with cancer. So I'm like, okay, what is my deal? What did I do with cancer? Did I buy something that I didn't pay or something? And it's not really easy for family members. It is not a palatable thing, especially you don't even know how to talk to your children. Sometimes the wife will not know how to tell the husband that she's been diagnosed. If the wife was not with the husband at the time of diagnosis, the husband may not know how to tell the wife and the children. So in our community, people keep it. And one of the reasons why I decided not to keep quiet when my husband was diagnosed is in our community here in Calgary, we've buried a lot of people due to cancer. And you only hear that they have cancer when it's already late or when they are dead. So when my husband was diagnosed, I'm like, you know what? Nigeria is too far. There was nobody around. I need help. And people helped me. And so when it got better, that's how we started to give back. You know, to whom much is given, much is expected. So
Right.
we got the help, and we also decided to help other people. Family members, we all need to be reorientated. We all need to know what we are doing. It's not easy to have cancer. Trust me, you don't even want to wish it to your worst enemy. And that is why we decide to help as many people that we want to come forward. I know it's not easy, but I'm praying that one day cancer treatment will be like, what do you call this thing? HIV, where it's like maybe when people have cancer, they just ask them to take pill or take medicine. So family, the thing, it hits family. Is it the financial resources? Emotionally, psychologically, in every area, especially if you are self-employed. Cancer hits the family because as a self-employed person, you don't even get any EI. For those that are working, of course, you can still get either short-term or long-term
disability, right?
But what I've noticed in some of the people that we support is either they are new to Canada or they have not stayed longer. So some of them don't even have insurance.
Right.
And you know, apart from the cancer drugs that is being provided by the government, there are lots of out-of-pocket expenses that goes cancer treatment. And many people don't even have it. Like right now, things are so expensive. Housing is so expensive. People that do not work, how do they expect them when house rent is increasing daily? So it affects people in every areas.
Ken, let me bring you in here.
So let me make a comment about what Yinka is saying, and it's quite true. There are environmental factors that affect the Black community, such as, you know, the social determinants of health, the economics, the job. You got to feed your family, you know. So mental health, by focusing on a lot of these things, so, you know, the focus is quite different. So that, you know, it's the environmental factors, I think, that contribute to the high death rate.
Is there a little bit of culture in there as well? Can we talk about the way we tend to respond? HIV many years ago was similar in that people would not speak about HIV. If somebody had contracted HIV, you would never know. They would die, and it's this shame on the family. Ken, are we seeing that affect the way our community responds to the issue of cancer?
Yes. Well, the one cancers that we focus on is prostate cancer. So prostate cancer affects the men below the waist. And anything that you talk to a Black person, Black man below the waist, then there's no conversation. You know, I've had men say that I'd rather die than do the finger test. You know, or I want to continue to have sex the way I did as an 18-year-old right up until I die, and nothing's going to stop that. So there is this silence, anything below the waist. They don't want anything to be, you know, messing with that whole aspect of it. So then you find a high death rate rather than, you know, getting themselves fixed properly and then resuming a good quality of life. There is life after prostate cancer and a very good quality of life. But the rumors and the stigmas and the misinformation are preventing men from moving forward.
Yeah. Yinka, we've talked about this, and you've been doing it in Calgary, I know, and broader. Is the community getting the message?
Yes, I think they are, but we still have a lot of work to do. We need all the leaders in the community. A time is coming when we're going to bring together all the leaders, because when we are able to meet with the leaders, it's easier for us. The leaders will be able to pass the information down to the community. Well, why do I say community is getting it? It started just with my family. Now we have over 50 registered members, and plus those that don't want to register yet. I know the number may seem small, but to me, it is not small, considering how we started, considering the fact that people don't talk, considering the fact that people like to keep it to themselves, considering the fact that people don't want people that don't even come near my business, don't come near me. They have this wall right there. So we are getting it. We are having words of mouth. People are referring people to us. So the time is coming when we invite all the leaders. We'll let them know what we do. We'll let them know what the community will do. Right now, some churches are inviting us. Come and talk to us. Some communities are inviting us. We've been to how many communities now? We've been to different churches, because now they see that even church members, Islam and all those things, they see that, cancer doesn't know anybody, whether you are Christian, you are a Muslim, you are green, you are yellow, you are black. It affects everybody.
Right.
It affects everybody. So we are getting people are coming to us, but we still have a lot of work to do to continue to create awareness in the community, especially that our people need to go for screening, because early detection saves lives. If people go for screening and something is found and treated early, then there will be no death. Things will be done early.
Yeah.
Especially for women, for breast cancer. In fact, there is no cancer that is good. No good cancer. Cancer is cancer, right? But when we go for screening, then if something is found, it can easily be treated. Then we no longer have loss of life. And one of the things we are trying to do is to reduce the number of people dying of cancer. Some deaths can be prevented, right?
Let me bring you in here. Let's talk about the demographics a little bit. Are younger men as susceptible to prostate cancer? What are some of the things that you have seen and heard?
Well, we've seen men in their 40s. And when we ask them and question their background, and it's always their father or grandfather had prostate cancer. So we're looking at the genetics part of it. We are involved in this major research project that's looking for the presence of genes, a specific gene in the father or grandfather. And if that gene passes down or is present in the son, if that gene is present, which means they're now susceptible to prostate cancer. Why it occurs in younger men, we're not sure, but part of the research study is going to be looking at that. Because typically the average age is around 60, but we're seeing men in their 40s. And those men in their families have had prostate cancer. So there is that factor that we're looking at. We're involved in a major study with one of the major cancer centers in Toronto here that is looking at that aspect, the genomics of it.
Yeah. Let me ask both of you, this whole issue of prevention and screening. Talk to us about the process and talk to us about the mentality that we need to be sharing and getting across to our people.
So our theme for the Walnut Foundation is that early detection saves lives, and we've seen evidence of it. Men who've come to us and they're 50 or 51 or 52, and they simply insist on their physicians test them and they found that they had prostate cancer. Those men have changed their lifestyles, and they're all, 100% of them are all living good lives, cancer-free. They've regained their manhood. And so it proves that early detection does save lives. You have better options to take care of yourself. We talk about and we're going to talk about diet and exercise as well.
Right.
So, they've changed their entire lifestyle and they're living, great lives today. So early detection is a thing that we preach, especially if there's cancer in your family. And by the way, a lot of people we've spoken to, and we go to health fairs, we go to churches. Someone always stands up and says, "My father had prostate cancer." It always happens. We were at a church on Sunday doing a major presentation. So I asked the question, how many people here have got prostate cancer in their family? And about 50% of the people, men and women, put up their hands.
Yeah. Yinka, how do the partners help the men in particular to do the screening? Last week we were discussing mental health, and we talked about the cultural tendency of our men to avoid the doctor. And they only go when it's chronic. And therefore there is this need for a support mechanism to push them to do it. How does the partners and the families fit in to push them towards the screening?
Well, you already said it. Partner, like women, we need to push the men. Men don't like to go. They don't like to visit the doctors. I was talking to somebody, a guy said, "Oh, until maybe when he's almost dead, then he can go to see the doctor." We need to talk to all women. Please, when your husband is up to a certain age, maybe you have to hold the guy, take him to the doctor. It's not for anything. We are in a country where checkup, where medical is free. We are not back home where you have to pay to go for checkup or screening. So women or spouses need to encourage their spouses to go for checkup, because if something is found, it will be treated early. My husband, he does his medical checkup every year, and still, when they found his cancer, it was like 60% all over his body. Sometimes these doctors misses something. If he was not going for the medical checkup, a yearly medical checkup, maybe they would not have found anything. So the yearly medical checkup, all you need to do is just to take time off work. Somebody was telling me, I was making presentation to one organization, and someone raised their hand and said, "Oh, is it possible for the doctor or the nurses to send the test kits to his house because he is very busy?" And I'm like, it's because you have life. People that are sick right now, they will not say that. Say, "Oh, I'm a busy person. Is it possible for them to send the test kit?" I'm like, "You want to do a PSA test in your house?" I don't know how that is done. I don't even know how they do it. You have to carry yourself and visit your doctor. And I was saying that if his wife was there, as at that time, she needs to take her husband, hold his hand and take.
So we're going to the doctor because you need to get that checkup.
So spouses have a very important role in the lives of a spouse diagnosed with cancer, because caregivers have this burden. Sometimes caregivers get burnt out.
Right.
Caregivers also need help. I'm a caregiver, and I can say it from experience. Caregivers sometimes are sick as the person on the bed, because it is the caregiver that knows everything. The person that is sick is on the bed, right? May not even know what is going on. So it is this caregiver that how does the mental thing that goes around go through the emotional process, even know everything that the patient doesn't even know. So as much as we are helping the patients, let us remember the caregivers.
Yeah. Ken, let me bring you in a little bit here to talk about some of the myths, especially about prostate cancer, because I have no doubt, while I haven't discussed it in the Jamaican community, there's no question in my mind that there are things that people think prostate cancer is and prostate cancer does. Let's talk about that a little bit.
Yeah, this, we hear it directly from the barbershops. It's a gay man's disease.
Wow.
Only very old men get prostate cancer. Then, if I get the finger test, then I will turn gay. Those are some of the information, the misinformation that goes around that prevents men from, men are proud to say, I'm not going to get the test.
Right.
Very, very proud to say that.
Yeah, but not do that because...
Exactly. You're not doing that. Not doing that to me. But in the meantime, they find, we've seen men with advanced cancer. And at that point, then they start scrambling because at that point, it's too late.
Right.
When it could have been avoided at a younger age and being treated for it.
When we go to the barbershops and we start having and normalizing this conversation, because this is part of what we're trying to do here on Watagwan. Normalize the conversation. It's no different than talking about COVID or the cold or the flu season or the economy, right? But of course, we have to kick down some cultural barriers in the process, right? I'm going to bring Yinka in. The Oladele Foundation is launching, or is being launched officially, and you're having a program tomorrow. Let's talk a little bit about that and why programs like those and foundations like yours are important for the community.
Okay. First, I'll tell you what we do. Then I'll talk about the launch. Like I said earlier, we started to support people. We bridge the gap between the hospital, the community, and the patients. There are so many things that cancer patients need when they leave the hospital. Cancer patient needs help. They need resources. So we come in. For example, when someone is diagnosed, they are in that mental stage where they don't even know what to do. They don't know how to go about it. I remember when my husband was diagnosed, they just gave me a package and we went home. We were both confused. We didn't know what to do. At that time, I needed someone to talk to. I needed someone to hold my hand and say, you know what? It's going to be okay. So now when people are diagnosed and they reach out to us, we are able to talk to them that you will make it. Other people have made it. Last year, a lady was diagnosed. She actually thought she was going to die. She started writing her will. She was so confused, and someone introduced her to us. And in our community, it's a safe place, it's a safe environment where the survivors are able to provide word of encouragement, word of hope to those that are receiving treatment, to the newly diagnosed. And we have that safe environment to help people to let them know that when they are diagnosed with cancer, it's not necessarily a death sentence. Because sometimes it is not the cancer itself that kills people. Sometimes it's our mental state. Sometimes it could be complications. It could be so many things. People are able to ask questions and receive answers. We don't give medical advice. We ask them to talk to their doctor. But when you see someone who has gone through what you are going through, it's easier. And the other thing is we provide a culturally appropriate support services to people. Because we are Black, the way we reason is different. Mm-hmm. We have culturally appropriate, we have counselors among us who knows how to deal with us. When a Black man or a Black woman goes to the doctor and say, oh, rate your pain level 0 to 10, they will say, oh, it's 2. Meanwhile, that pain is like 20. But a Black counselor can say, you know what, I know that pain, just tell me. That is a way you talk. Then you will say, oh, yes, that pain is very high. Right. The Caucasian will just say, okay, you still will just write 2. Meanwhile, you are suffering. And apart from that, we also help cancer patients with meals. when they go for treatments, we ask them, what are you craving? So we get caterers to prepare meal and they put it in their fridge or freezer so that after the treatment and when they go home, they don't have to start cooking. Some people after treatment, they cannot even do anything for the next 2-3 days. And that's when they need help the most. So we come in through there. And also, infection is very, it can kill. There are some like little things. When my husband was going through a stem cell transplant, they said, oh, the house has to be sparkly clean. And I was so tired as a caregiver, I cannot even clean myself. Yeah, I was tired. He was tired. So we have to bring in a cleaner to clean the house. So we now help our members to clean their homes just to prevent anything. We don't want any infection to happen. We are just trying to guide against complications or what have you. We offer different things that is tailored towards our people. And we have members across board, whether from Africa, different countries in Africa. We have Jamaica, we have from the islands also. So it's called the African Cancer Support Group from people of African origin. People of African origin, of all people of African descent, we deal with them, we help them out. So please reach out. It is free. It is a free service. Thank you.
Can talk to us about the Walnut Foundation. What are some of the things that you do, your team does around all of this?
So we've got a couple of focuses. The biggest one is education, building awareness. We go into churches, community groups, community health fairs. We're basically spreading the word through that. The second area of focus is we run a very successful prostate cancer support group for men, where men join by Zoom who are just been diagnosed, they've just come from the doctor, they're going through treatments, they got to make decisions, they're going through mental stress. We get together once a month over Zoom, cameras on, and the men share their experiences. We really don't give medical advice, but we just share their experiences. We've had a lot of men come into the group that they've changed their decisions based on what they've learned. They always thank us very much about the support they get. The other area of focus is that we're trying to change the systems. In order to do that, we have to do research. So right now we're involved in 3 research projects, looking at genetics of cancer. We're looking at cancer care in older adults. We're also looking at social inequities of among prostate cancer men in Canada. So we do a lot of research, are involved in a lot of research. The other areas that we're also involved in, and this is something that we hear from our men, when you go to a hospital for cancer treatment, you don't see our faces at all. You don't see Black people. So what we've done is we've started to invest in an endowment we started with the University of Toronto Medical School. And that endowment is going to be used to give scholarships to Black medical students entering that university. And we're going to be expanding to other universities as well. We got to start somewhere to change the system. And so we're working with the University of Toronto to make sure that more Black students are admitted to that medical school. In a few years, we're going to start to see the difference. We're going to start to see more Blacks in cancer care. Right now, in the Toronto area, we know of 1 urologist. And Toronto has a population, whole greater Toronto, of 7 million people. And they've got 1 Black urologist.
Yeah.
So something is wrong with the picture, and we got to help ourselves in changing that.
Yeah. I want to wrap up the discussion by talking about the aftercare and some of the things that we need to do, especially around diet and lifestyle. Yinka, maybe I start with you because you started it earlier. What are some of the things that our men and our families need to understand and start adjusting as it relates to diet and lifestyle in dealing with cancers?
Well, for example, in our group, we have a health coach. The health coach also, she's gone through the cancer treatments and now went for training. So she comes in to give us proper training on health. And also when people want to go for health coaching, we pay so that they go for individual health coaching, maybe your lifestyle. When it comes to diet, I'm not a dietitian, so I cannot tell people eat this or don't eat this. For example, when my husband was going through his treatment, my people say, oh, you should not eat this, you should not eat this. Then I asked the doctor. He said, well, the guy is sick already. Do you want to deny him? Say, everything is in moderation. And I see to that. Everything is in moderation. And that is why when we also have webinars every other month, we bring in professionals to talk on different topics, maybe on lifestyle, maybe on nutrition. So I cannot tell anybody about diets. I'm a Nigerian. I eat my food. I eat my food. I eat my food. So I cannot really tell anybody that eat this or don't eat it. And that is why we ask people, please talk to your doctor.
Right.
Talk to your doctor.
Ken, what's your take on this whole issue of diet and lifestyle, especially for prostate cancer?
Yeah, there is scientific evidence that exercise plays a huge role, and diet as well too, in managing prostate cancer diagnosis. There is scientific evidence that it actually delays it. Now, we're talking of the body is made to move. So we're talking about an exercise program starting young, cutting down on salt, cutting down on sugar, right? Cutting down on red meats. And there's actually scientific proof to show that managing your diet and exercise plays a huge role in prostate cancer diagnosis. It doesn't prevent you from getting prostate cancer. However, if you're diagnosed, then your chances are much better of tackling the disease. And so we invite scientists actually to a lot of our conferences where they present the scientific evidence to back that up. And then in the United States, there's a lot of research work going on. I know for sure in the southern United States, which has the highest prostate cancer death rate in the United States among Black men. And if you look at their diets in a lot of the southern states, it's all McDonald's and it's all fried chicken, and there's no greens in their diets, and it's all things like Coke. They drink Coke for breakfast, lunch, and dinner. So was this study out of one of the big universities where they shifted that and started to eat a different diet and started to do exercise and started to lose weight, and they found that the results were more positive.
Yeah, but granted, especially for the Jamaicans watching this, our concept of good food might be dumpling and yam and banana, and who knows? I mean, none of us are dietitians on here, but I think part of the learning, and I like what Yinka is saying, is moderation.
It's moderation.
There has to be an awareness of how moderation impacts what we do. All right, listen, the clock is ticking, and I get one more question for both of you. What's the biggest takeaway? What's the biggest learning that we want to share with the community and the families of our men as it relates to cancer? If there's only one thing that you could say to the community, Yinka, you first, what would that be?
Go for screening. Go check yourself out. It is free, right? It is free.
Ken, well, what's your one?
So in Calgary, it's probably free. In Toronto, you have to pay for it.
Really?
But you still what is still you're wanting to tell them though?
Get screened. And prostate cancer is a family disease. It's not a man's disease, because the family suffers just as much.
All right. Well, folks, you heard it. both of our participants who are very experienced in this space give you one line: get screened, right? Ken Noel from the Walnut Foundation, Yinka Oladele from the Oladele Foundation here in Calgary. Thank you both for being here on A Time to Reason on Gwaan and for sharing with us.
Thank you
Thank
for
you.
having us.
Thank you for having me.
All right, take care.
Take
Have a
care.
good day.
Listen, this has been a great discussion. David, thanks for taking the time. All right. All right. That was awesome. Great discussion with Ken and Yinka on cancers. And hopefully those who are watching take a few lessons, a few nuggets from the discussion. And for the men that are watching, get screened. I remember having this conversation with my doctor when I crossed, I think 45. Yes, I'm past 45. And it is always sometimes a little uncomfortable to start the conversation. But once the conversation is normalized, then I think we can broaden our perspective and we can look at the issue. I remember years ago when HIV and AIDS was the rampant thing, and I remember I had to do an insurance policy and I had to do a medical, and there was this eternal fear: what if I had AIDS? How do you deal with that? And it was more the societal perception that was fearful, or that I was fearful of. What are people going to think? And it definitely impacted the way I looked at myself and looked at my life, right? So I think all of us, I see Glenn saying, we definitely have to change our mentality to screening. And yeah, we have to, right? We have to look at it and we have to deal with the reality of what it is, right? We also have to ensure that those around us, we have to help to normalize the conversation for those around us. So talk to our families. My father is 90 years old. And there are a number of the elders in my family who have to deal with prostate issues. And it's not always an easy conversation for them. I remember having this conversation with my uncle a while back. He's in his 80s, but just talking about it and saying, no, it's an okay conversation. As men, we have to be able to focus on it, deal with the reality of it, and ensure that we're not creating these taboos, and also with demystifying some of the issues, right? The finger test is not going to turn you gay, right? It's just a medical procedure, no different than any other thing that has to be done to understand what is happening in the space. So people, let's help those around us. Let's help our men and help their families, because like Ken said, it's a family issue, right? If you are the caregiver, trust me. And if you are in a system where it is not as sophisticated, I can tell you, I was in Jamaica in March and I had to take my father to the public hospital, and it wasn't fun. It isn't smooth, and the hours are long. You wait, you have to go and do the tests and get the results and all the rest of it. So let's prepare ourselves and let's prepare those around us to have this conversation. All right. Another comment here. Let's throw it up. C's here says it's very informative. Our health is our wealth, and that's true, right? We really have to continue to share, and we're glad we could bring Ken and Yinka on to share some perspective. Thank you for doing that. All right, listen. Time is going. Patois word of the day: galang. If you were in Jamaica and you use it in a sentence, you would say something like, there's a song, "See the hypocrite them a galang." So it means to keep going, to continue. If somebody tell you for galang, right, that is what they're telling you to do, to continue, to keep going where you're going. So if you want galang down the road, right, and broke your neck, then that is your problem. So Patwa word of the day means keep going. Patwa word of the day today was galang. As always, we say you can share your message while we share our stories. There's an opportunity of seeing a couple of ads running on Gwaan. You can share your ad here too, so that people in Canada and all over the world actually can see your message as you help us grow, advertise with us. You can connect with us on our social media handles. You can send us an email at watagwancnd@gmail.com. Next week we're going to take a break. So if you're planning on watching, we might do a rerun of one of the shows next week, but we're going to have a little pause, and then we're back on the 16th with the Father's Day edition. You don't want to miss this one, because we're going to talk with some fathers about the journey and how it has been for them. As always, we encourage you to follow us, subscribe, share, jump on any of our social media platforms. We are on Facebook, we're on Instagram, we're on YouTube, we're on LinkedIn, and of course, you can jump on our website, watagwan.ca, and you can see previous episodes, and you can share with us there as well. As always, it is a pleasure sharing with you on a Friday evening or whenever you consume Gwaan. This is our way of sharing culture, sharing information. Hopefully you find it useful. Send us some feedback so we know how we're doing and whether or not you are getting value from the interactions here on Gwaan. We will be back, like I said, on the 16th. We're going to take a break next week. So until then, stay safe, be good wherever you are, and I suppose if you can be good, be careful. But whatever you do, stay blessed. All right, take care.